So let me now invite the next panelists to talk about the health dimension of the good governance in grassroots sport. And I will hand the torch or pass the torch over to Peter Sapins, the president of the Latvian Physicians Association, and would like to invite the panels. Enes Fogels, the Olympic team COB, Anna Null, the National Health Center Vaivari, chairman of the board, Liga Cīruli, from the Olympic squad. She's the chief doctor. So Liga Cīruli, so instead of Anda, will be here because Anda is here. Not really sure. Dear colleagues, we are the last panel session. The idea most probably was that, first we have to say good things and we can end with criticism. Usually, I'm asked to encourage everyone to get engaged in grassroots sports, and Enes will probably also explain the negative side of the grassroots sport, and that's why I've invited the leading rehabilitologist in Latvia, the chairman of the board of the Rehabilitation Center Vaivari, the head or the president of the Rehabilitation Association. Anna has been a professional sportswoman herself. She's an excellent doctor, so she knows what sort of health problems can active or sporting lead to. And a professional sports doctor who's worked with the bobsleighing team and other athletes, Cruz. She knows what problems athletes have before they need rehabilitation. But I'll start with introducing my perspective. I'm also active orienteering enthusiast. There are enough orienteering runners here, represented here. So we are talking about grassroots sports, and grassroots sports entails excessive use of medicines, various herbal products, and various drinks and powders, excessive physical exercising without doctors, without consulting doctors, consulting experts, excessive use of doping. 80% of doping actually is consumed by the grassroots sportists and seniors, not the pros. Various injuries and various sicknesses and even tragic outcome may be the result of wrong grassroots sporting practices. So amateur sportsmen use analgesics, painkillers basically, pseudoephedrine, methamphetamines, and other psychoactive substances, growth hormones and steroids, and they also fall victims of the advertising and use various food additives that are not really healthy. They use a lot of caffeine and a lot of proteins as well. They suffer from exhaustion and from weaknesses. They use alcohol before the competition, during the competition, after the competition as an antidepressant. So we are we're fighting with depression the way we know. In amateur sport and veteran sports and in survival sports, and Vesters and I, we are also from the survival sports as well. People use anabolic and androgynous steroids because some want to become more manly, get rid of their beer belly, but they also consume them unconsciously as well, basically consuming food additives sold in stores. A bit about the injuries of professional sports. Injuries are something incredible. When I was watching Briedis fight Djurdal, I was watching, now this punch, could bring a ball down, knock a ball down, a concussion, second blow, most probably a hemorrhage, and the injury to the front brain, frontal, to the lobe, and it may end in unconsciousness, and it's good that the skull has not been fractured and so on and so forth. So how many people are engaged in grassroots sports? Well, more than we think, actually. According to Eurobarometer, most of the people are engaged in one or another sporting activity, and they do it on a sort of spontaneous basis, not on a regular basis. We say that the grassroots sports, competitive sports, international, professional sports, that's the sort of discrimination, but that's a very simplified approach to it. There is the Paralympic sports and the sporting activities of people with disabilities, and also excessive sporting. If we look at our physical activity, walking would not be sporting. There's aerobic exercising and intense training. And when children have been raised, you're bored with your wife, then people turn to sports, or you're fed up with your work, or you're in pre-retirement age, then you turn to sports in an entirely different way. It's sort of a midlife crisis hits you, then you sort of get engaged in sports and you get very heavy injuries. Boxing is the most traumatic sport, severe traumas. Well, American football. And I asked Bartram Zaric, who's the head doctor of the England Patriots to this day. He deals with fractured shoulders and fractured neck every competitive game, very, very severe injuries. Football. You've asked the question a number of times. Football is really very popular sport, so that's why most of the injuries go to football, followed by cycling. In Latvia, we see a different situation. We're engaged in much more sports disciplines, and competitive sports give us the edge in a sense. Injuries differ. Pros are much more collected than the amateurs, and Janis Naglis talked about the men's hockey, ice hockey, and each of them has had a shoulder injury or neck injury. It's just impossible to go without the injuries when you're being tackled, for example. And senior athletes, it surprises me that no one is hospitalized after that. Downhill skiing, there are different sports injuries depending on the discipline. Just to show you, you can read it afterwards. It's not really that important. The most common injuries, and you can read it on our webpage, on the Latvian Sport Federation's Council webpage, so I'll skip those. So what concerns injuries, mostly those injuries occur on ankles and knees. Veterans also injure their head quite often. What are the consequences of head injury? You know yourself, most probably. Just to remind you that after the injury, you need to stay calm, you need to use ice, and do not train yourself. So pain leads to various vascular problems, various hemorrhages, and various blood clots occur that lead to other health problems. Now, the death in sports. Sports and death are intertwined. We are talking amongst professionals. And alpinism or mountain climbing is the most lethal sort of sporting activity. Which one goes second? Equestrian sports, or horseback riding, especially for girls, and motorbike racing is the number 3 in terms of lethality and new downhill disciplines. There are 0.75 deaths per 100,000 marathon runners, half marathon runners. So roughly 4 hours after finishing in the recovery sort of phase, deaths may occur. This statistic has not changed in the last 30 years. Just the number of runners has increased exponentially. So 0.33 has been sort of the average figure in 70s, 80s, and so on and so forth. Just the number of runners has increased nowadays, and per every 5,000 marathon runners, there's at least one who suffers severe damage to health, and similar number of people die during the training as well. Two severe cases resulting from overrunning yourself, running yourself into the problems. And this is from the marathon. Hypoglycemia, hypovolemia, hypertension is one of the problems caused by the running. I was watching one of these events, and I was on the finish line, and it was a good result. 1 hour and 15 minutes for half marathon. A girl a bit younger than me, 45. I don't know really her age, but she had a very good result. And I saw some 100 meters from the finishing line, she was unable to gather herself. She was, swaying from side to side, and she was unable to finish. And the gentleman just picked her up, lifted her up, and helped her to the finish. And she collapsed right after the finish. Then paramedic, or somebody like that, ran to her with some medicine, and he, darted towards her and tried to get to her. If he would manage to get to her, she would have probably died, but thankfully she survived. Drinking or hydration is very important. You need to hydrate yourself. If you use 40% of the water, you lose your sort of capacity by 30%. This is what sportsmen forget, and they end up with being hypolimic. 30% of mass loss is basically due to water loss in your body, so you need to drink every 15 minutes basically when actively exercising. Some of the drinks lead to diarrhea, or, excessive water, or dehydration, coffee, and other sports drinks. Considered doping and hormone medicines, hormone substances. It may seem surprising. And, I just wanted to mention this because, it's very easy to buy. EPO is the EPO. Erythropoietin, most common or most popular doping, which is very, very bad for your health, entails a lot of health hazards. And you can buy it in that, surprisingly, although we use euro for about, a year. So that's the sort of the Russian generic version of the EPO. You can buy it freely on the internet without any restrictions. In our medicines register, we have 4,583 medicines, out of which 3,657 are, recommended for the sportsman. The rest are not, and that's just a list of recommended medicine that you should use. S2 is also mildronate, or meldonium is also part of those banned, or on those banned substances list. 80% of the doping is used by the veterans or by the seniors. Now, what concerns veteran sportsmen, we have our own opinion. For example, what concerns figure skating, they retire much earlier than marathon runners, or, for example, equestrian or horseback riders. Well, it depends on when you feel yourself as a veteran, but the veteran sports is not subject to any anti-doping checks or controls, and basically, doping is freely used by the veterans. Gentlemen of my age, the veterans, on a daily basis, they have to use the antiarrhythmic substances and beta blockers and so on and so forth that are used by sportsmen as a doping. So why do senior citizens continue engaging in sports? To improve their appearances, to boost their health and lose weight. So because of that, a lot of them are using stimulators or various stimulating substances. So what do free time the sportsmen do, or veterans? They work for 8 hours, they help their family, they're socially active mostly, that's the profile, and they do sports in their free time. They use various food additives and also, unwittingly, also use various medicines, or the painkillers in particular, just to relieve the pain. There have been several studies conducted. People use analgesics for major sports events to relieve their joint pain and muscle pain and fatigue, get rid of the fatigue. They use a lot of ibuprofen, diclofenac, and other substances. And then there are stimulators that are used by the veterans to lose weight or keep themselves, going. Amphetamines that are consumed by children through various medicines, together with alcohol, they are used by the veterans extensively or excessively. Ephedrine is also used. And believe it or not, the children are also using amphetamine group drugs, and coaches support that, parents support that. A bit about endogenous anabolic substances, mostly used to improve your looks and to lift heavier weights. In Latvia, in the veteran sports, there are very few weightlifters, or the weightlifters, or the arm wrestlers or boxers who have never used those substances.
Basically, they come from China, brought in as contraband, and there are various distribution channels for these substances. But the main problem with the hormonal substances may cause cancer, and especially in case of prostate cancer, these substances definitely act as catalyzers. Also, creatine is something that is overused as a means of revitalization. Also, a lot of various protein mixes are offered in the market. What concerns meldonium or mildronate, I've never prescribed this medicine to any of my patients. This is produced in Latvia by Olain Farm and Grindex, two producers, which is developed locally, and the author received a prize for it. However, recently it has been included in the list of prohibited substances in the sport. Before that, there have been no studies regarding its influence. Yes, we have heard about these slogans, "Welcome to Meldony City." Now also Mr. Lipmans is also very active in support of this substance. But we haven't had any lethal outcomes. We don't have any injuries or addictions. So from this perspective, Meldony is the least danger of doping. For example, Maria Sharapova was caught using this substance, and during her training sessions, and it seems like especially amateurs are very keen on using it. But of course, we should only rely on evidence-based studies, and we should, of course, carry out thorough studies. Only then we can rely on these randomized or double-blind studies, and so far just 8 such studies have been conducted on Meldony. yes, it has certain influence on a human's heart, but basically there is no scientific proof. But of course, if it leaves a positive impact on someone who suffers from a heart disease, then of course it could enhance the performance of those who are healthy. And many recreational athletes in Latvia have switched to this medicine. But as to the dosages and general trends in the use, currently I don't have appropriate research at my disposals to make conclusive conclusions, especially in cases where L-Carnitine has been used for several years. But just like in many other cases, they somehow leak from the professional sports also into amateur sports. So currently there is a boom of buying out L-Carnitine in pharmacies across Europe and also in other parts of the world, because it was actually a great publicity stunt, these scandals of prohibiting it. And only the future research will show what it actually does to a body. So another substance which is L-Carnitine, and we have plenty of supplements that are sold in Latvia that contain this substance, and especially weightlifters or bodybuilders are very keen on this L-Carnitine, discovered by a Latvian professor. And unfortunately, he was not given the Nobel Prize simply because at that time the World War I was in progress. And also meat contains the same substance, but of course in much smaller concentrations. Also potatoes, but it would take enormous amounts in order to reach the concentration that is offered in various supplements in the market. Okay, but I will not go into details of biochemistry. But basically, it's very popular among bodybuilders. It seems to be an innocent substance, but in the long term, it raises the blood pressure, and probably L-Carnitine would actually compensate for the negative effects of this substance. And I have included some slides on this interaction, and I will not go now into more details. But anyway, it improves the resilience of a human's heart, especially under great workloads. So, generally speaking, of course, physical activity is important in all age groups. However, please be cautious to who you listen to, and be cautious what trends you follow, and just be wise whenever you engage in sports activity, because many do it on their own without any professional assistance. But let me put it simply. what we need is physical activity of at least 30 minutes out of 1,440 minutes a day. Then, of course, we would be much healthier, we would live longer, and spend less on medicine. And now I will give floor to my colleague Anda. Good afternoon, ladies and gentlemen. Of course, it's very difficult to talk about the in-depth overview by Dr. Appinis. Nevertheless, thank you very much for inviting me. And I also represent the field of sports medicine. I have worked for several years in the sports academy. And I work for Vaivari Rehabilitation Center now. Of course, we talk a lot about promoting sports activities, but also in my presentation, will talk about some risks that we may encounter. Of course, we all know what is sports, but here I have included some quite complicated definitions of what is sports activity, which probably answers a lot of questions, because it's not only meant to improve your health, but also to reach high-level results. And what concerns aging, of course, we are all subject to aging. The average life expectancy in Latvia is 74.6 years, slightly less among men. And normally, aging would progress in a healthy manner. And aging doesn't mean you have to be suffer from various illnesses or otherwise. You still may retain quality of life. Probably it wouldn't be so fast, so active. Nevertheless, people should maintain their functionality, so to say. And of course, we have the chronological aging and biological aging. Sometimes they coincide, sometimes there are significant differences. And if we look at chronological aging, of course, how we classify various stages of life are quite different, and different books provide different definitions. Who are to be considered senior citizens? For example, some books refer to 55 to 70 years as seniors. Some go well above these numbers. So there are different views on what are the various stages of life. What concerns healthcare, we are looking forward to still live to see 2060. And according to forecasts, Latvia's population will continue to age. We will have a large proportion of seniors, up to 30% of total population. Hopefully they will be healthy and active. And in my specialty, which is rehabilitation, we have this international functionality encyclopedia that we rely on, and We always mention it as a reference. But actually, it can be quite useful. Initially, it was published in 2001, and now that 15 years have passed, quite many support this classification regarding state of health or aging, and because it is directly connected with the loss of functionality at the cellular level, which of course leaves impact on our limbs, on joints, and we become less active with age, which leaves impact on social life and on working life and also sports activities. But also, of course, environmental factors play an important role. If we have a lot of sports infrastructures and then different kinds of running courses and bicycle tracks, etc., then of course it contributes to a healthier lifestyle and healthier aging. Nevertheless, we cannot escape the biological clock. Our cells are aging constantly and irreversibly. And of course, I will not go into very dry details, but if we look on the cardiovascular system, on the support system, of course, it all, with time, it all deteriorates. And here I should refer to the previous speaker who said if we'll use better blockers, then of course we may even intensify the damage to heart valves. And of course also respiratory system suffers from aging, and we are no longer able to provide our cells with all the oxygen they need. Of course, also the muscular and skeletal systems, they suffer from weight loss. So-called fast fibers are the first to go. Of course, I will not go into details about the levels of growth hormones and testosterone. And this results in the reduction of density in bones and muscle mass. Likewise, also the nervous system is subject to aging. The reaction time extends, the coordination weakens. Nevertheless, the number of seniors who are actively engaged in sports is steadily increasing. And also mass media promotes the idea that sports is something that you should do to remain healthy. But of course, it's good to have physical activity, but with age, you should always keep in mind that you are exposed to much greater risk of injury. So you always have to remember to stretch, to warm up, and also take into account your background. And this is something not only physicians should think about, but also everyone who participates in various sports activities. Of course, various injuries are caused by various sports activities, especially among senior citizens, and dehydration is one of the factors that leads to injuries. So various exercises should be included in your sports routine to improve your balance, your coordination, which is very important in all kinds of sports. Also, of course, the injuries that come from excessive loads. On one hand, of course, running is good for you, but if you overdo your running, you may experience back pains, joint pains, and when you come to a doctor says simply you should quit running. But it shouldn't be black or white. And especially for veterans, it's very difficult for them to simply quit running because this is something that they have done throughout their lives. And sometimes all they need is to take a couple of days off. And here also I should mention the sports equipment, what type of footwear they use, and because inappropriate footwear may result in various skeletal deformations. Swimming seems to be a very innocent type of activity. However, there are many injuries, both muscular and also joints, especially in shoulder area, and especially veterans, they use fins, not only on their feet but also on their hands, which of course increases the resistance and may cause injuries.
Cycling, well, you've got to be very careful about what you do. You have to choose the right seat, the right attire. Older people should not push themselves too far. If you like to fall, if you prefer injuries, then that's of course your choice. But golf hasn't been mentioned. I have to be frank with you, I'm not a golf player, so this is just this comes from the theory, so various joint problems, limb problems, proper warm-up might help, and if you have pain somewhere, then just don't play, just mow the lawn on the golf course or something like that. Mountain climbing, well, you might think that people, as they get older, they get more sensible. No, that's wrong. Quite many people try to push themselves, climb the Mont Blanc, and are reckless in general, so hypothermia, freezing, and so on and so forth, fatigue, that all affects all the climbers quite frequently. And then I started thinking about skiing, and skiing, is everyone's individual choice, personal choice, depends on your background. You can drive the black piste, or you can go down the black piste, or you can go down the red or blue ones. But I've seen seniors snowboarding and also jumping, but you have to be careful in terms of injuries. But that, of course, all of these injuries or potential harms and risks do not prevent anyone from sports. I just wanted to remind you that sporting is good, but be careful. Be careful. Preparation is key to avoid injuries. I think we all agree that it's better to live a long and wonderful life instead of dying suddenly because of pushing yourself too far. Physical training, unfortunately, will not slow down the biological aging. We can drink carotene and meldonine, but we nevertheless are getting older. That's a fact. Maybe we can live a wonderful life, a better life, without harming ourselves or by pushing ourselves over the edge, sort of. And here are some of the myths that I'd like to bust. And I've heard those myths mostly from my patients, from the block, from the building next to me. Older people say that it's not worth getting engaged in sporting activities. Old people should rest, sleep more, they can fall, and they can injure themselves. And there are people who say, you know, I'm too old to continue sports activities, or I'm sick and I can't do it. Well, I'm too sick to exercise. Well, that's an absolute rubbish. You know, I've been living for that, been working for the last 20 years in rehabilitation. I have seen many people whose physical movement has been limited, but none of them has been too sick to exercise. Some say that, you know, exercising will damage my joints and bones may break. Well, that's not true, absolutely. At least in the case of the old people. So then I started thinking, where do we get those myths from? Initially, I included here mass media and GPs, general practitioners. Then I reshuffled this list, and I realized that it all starts with the family. And if a spouse is active, then the other spouse also gets actively engaged in sports. If parents are have active lifestyle, children also have active lifestyle. School promotes that. Environment, physicians, dentists also can promote active lifestyles. You know, while they are working on people's teeth, they have the opportunity to promote those sporting activities. So I'd like to encourage everyone to be active. Thank you. And now I'd like to hand it over to my course mate, in fact, an exceptional sports physician, the long-time chief doctor of the Latvian Olympic bobsleighing team and the rowing team as well. You know, I mostly see Zana when she's standing on the side of the bobsleigh track or luge track. I'm working for the Olympic squad, and I'm the chief doctor. I'm responsible for bobsleigh team, for rowers, rowers, and other sportsmen. So I'm mostly dealing with professional sportsmen, but I sometimes consult or provide consultations to the people who are either engaged or about to engage in grassroots sports, and I enjoy conversations with them, and I'm happy to consult them. But before we start working with them, I always say to people, you know, you should choose very wisely. If everyone runs, it doesn't mean that I should be running as well. I should, first of all, consider my age, my health condition, what would bring me joy and what would I enjoy. You know, those are the aspects to be considered, factors to be considered before choosing grassroots sports. So you should go to the doctor, you should check your heart rate and so on and so forth, have a cardio check-up, and we have all the necessary equipment to perform those tests and checks. And quite many people, not only pros, come to us to check their health condition, just to make sure that they are fit enough to get engaged in particular sports activities, and that they have to also prepare for sporting activities mentally. You know, at any age, it is very important to remember that you need to also exercise your abdomen. You know, you need to exercise in general, because strong abdomen is very, very important for any sports. You cannot lift weights if you don't have strong abdomen. You cannot engage in any other sporting activities if you don't have strong abdomen, because you might get injuries. Then it's also very important to look at your endurance, to examine your endurance. You should start small and then sort of increase the load. It's very important to have, advice as well, somebody who can consult you on how to start or pick up the sports that you have chosen. That's why there are sports doctors who are ready to provide advice at any time, whenever it's needed. So, thank you. Thank you. And while you're thinking about questions, I have a question about Vivari. You most probably also have people who are engaged in grassroots sports, or the amateurs, pros. When they get injured, they realize, I slipped, or they know why or what led to the injury. They've done something wrong. Just looking at the hockey team, they do something and then they start thinking, maybe I shouldn't have gone to practice. That's my hockey team. After partying, I should have had a proper warm-up. I should have skipped probably practice. But pros should have been smarter. Do pros also have mistakes? Well, and you have also grassroots patients as well. Yes, we do have those with some chronic conditions, with some physical disabilities, but mostly those are young people who've just not put enough thought into preparation. Sort of this sports hygiene has been overlooked, so then we have to provide them recovery from those injuries and also tell them what to do to prevent those injuries. Yes, we have quite a lot of those cases involved. And then, yes, some sports deaths have been mentioned. We don't want to end on a sad note, but in an amateur hockey league in which I am playing, sometimes we've had several cases, lethal cases of such kind. And our team was told, you should have your health checkups and you need to have sort of the test results on hand that you need to present because you're responsible for your health. So you also have this responsibility or accountability. But how accessible those tests are, and are they necessary? And then Peters, we could answer both to this question. My basic job or base job is in the Olympic team, in the Olympic committee, and we've been monitoring or checking the sports medicine agency recently. I don't know why they have not sent any representatives here, because from them we could get more information on children. The National Sports Council sent a lot of questions to the Ministry of Health asking, how those youngsters that are getting engaged in sports are checked, how their health condition is tested, because we've heard from doctors that we need to first of all test ourselves, perform our health check to understand what we can do and what we shouldn't do. Because, parents are also responsible for the children. And surprisingly enough, on our Olympic squad, when we've tested some of the children, we then face the parents, and then the parents ask, why have you banned him? Why have you suggested he should quit? We've invested so much in him that he's been playing hockey for, that many years, and now he has to quit. Well, it might be hard, psychologically or mentally, but not only children are responsible for their health, but parents as well. Now, what concerns adult sportsmen, yes, lately there's been a growing trend observed. We can see a growing trend, basically. There's a new lab that was opened, and there are already waiting lines up to the September. So, therefore, access of all Latvians to various tests is limited. There are people who are taking part in cycling races or on regular basis, people who are taking part in various marathons. But we, of course, have preferential treatment for the Olympic team, and then we can, take the others, amateurs. But we have limited resources to perform tests on amateurs. Maybe Peters can elaborate and can explain what are the sort of health sector's plans for this. But unfortunately, the testing opportunities in Latvia are unfortunately limited at the moment. Yes, thank you for the question. Well, we all are born, we all die, we are all born healthy, we all die sick. we are born little and we're born young and we die old. So the only objective that the state has is to make sure people live long and happy life. I don't know how long, and I don't know what should be the sort of level of happiness, but that's the sort of the definition. And healthcare sort of should be aligned to this objective. Our life expectancy has increased by 9 years since 1990s. By 9 years, we can, we can overlook the advancement of the medical technologies, and we can listen or not listen to all sorts of rubbish from the clowns like the Minister of Health. But our life expectancy is growing because we are eating healthier, the air is cleaner, water is cleaner compared to 1990s. But it seems that this life expectancy has grown largely to people being more active, and this culture of active lifestyle is spreading, and smoking has gone down as well because of the smoking bans on bars and so on and so forth. Although our doctors are saying that we have worst sort of public health indicators in Europe, but actually those indicators are improving. But this is not about not about sort of lifestyle choices. Everyone wants to live as long as possible. And if people, on average, will live 20 years longer, that will create pressure on the health budget. I mean, it will cost us something. Of course, we're not trying to save on people's health at the expense of people's health, but the increasing life expectancy, of course, creates additional financial pressure on the health budget. But everyone, of course, deserves to live a long life. And then there's also the issue of, well, I've been throughout my life, I've been in situations. My teammate unfortunately died on the basketball court. That sort of provokes some thinking. Should I stay in bed or should I go to the basketball practice? Anyway, that's probably not the worst way of going. That's not the worst way of going on the court or while exercising. And you can open the news portals, and every day you can read about somebody murdered, somebody hit by a car and dying as a result, or somebody drowning. There are very few people dying from sports activities, and that should by no means be something preventing people from engaging in sports activities. We should rather talk about health checkups. Those amateur sportsmen need health checkups and need tests. Of course, they shouldn't test for everything, the sugar levels and cholesterol levels and the C-active C substances, should be checked, but ECG will not really give you any sort of detailed information, and instead of taking a normal ECG and running a marathon, performing more checkups, that wouldn't help either. Extrasystrol, hypertension, ECG, heart or cardiovascular checkup are the three must-haves if you're picking up sports at the older age, or if you're resuming sporting activities after some time. And I have a wonderful colleague here from Kurzeme. He's my age, and he's running around Mont Blanc, 170 kilometers, and it's at the height of 4.3 kilometers an hour. don't really believe that he's not using EPOs. He can tell me whatever he wants, but I'll never believe that he's going without drugs, performance-enhancing drugs. He says honestly that he's drinking isotonic various drinks, but if he would have been running in, the same way since his childhood, I would believe him that he does it without any enhancing drugs. But most of the people are trying, using different ways of enhancing their performance. The Scandinavian orienteering enthusiasts, when they retire, they go to camps in Portugal and Spain before the World Championships for the seniors. They go to the hills, to the Austrian hills and Switzerland, and spend roughly a month training there. And they use everything that they shouldn't be using. And they are running just as fast, although they are retired at the age of 65. Although in the age group 75, 70, the speed is even higher than 55, 60. That is something unnatural, really. 75, 80, then they slow down. Thank you.
Now, questions from the audience. It's rather not a question but comment regarding the accessibility to doctors. I must say that in Jelgava city we have even 2 specialists, and one was headhunted actually from Riga, so currently we have 2 specialists, and we have the physical therapy room which helps with the injuries. So these opportunities are available to our residents, so you are welcome to visit them. Thank you for your advertisement. My name is Santa Wilter from the Sports Medicine Center. And it's not that our director doesn't let anyone go anywhere. Actually, I'm in charge of sports medicine, and I'm also a practitioner. And I will not go into a deep discussion here. But let me just mention that our staff members, whenever we go to the regions and visit sports schools, they, in a way, carry out also a social function, especially in the context of grassroots sports. And the main problem is with children who have some health problems and who shouldn't be participating in competitive sports, especially in high-intensity disciplines. And the problem is to find the right level or intensity of sports activity appropriate for each such child, because the workloads should be adjusted accordingly for each specific case and taking into account their specific limitations. And of course, for coaches, it is quite challenging because on one hand, they have high-performing children, and along them, they also have these children with health problems. And variable intensity should be the best approach, and low-intensity sports such as table tennis should be probably promoted among these children, because this is quite a problem currently. Because the only alternative is for them to lie down on the couch and watch TV or play computer games. If we fail to offer appropriate dosage, so to say, of physical activity. And this, of course, applies to football as a competitive team sport, which is quite demanding physically. Thank you. Oh, yes, I apologize, but I officially received a refusal to participate in this panel. Yes, but a couple of hours ago, he said that golf is also quite widely available in Valmiera city. I represent the Liepāja City Council sports department. As we implemented the sports arena project, we cooperated closely with the Ministry of Health. They helped us with designing the whole building, and we also provided for rooms, also for medical purposes. And also, to finalize the project, we had to receive an approval from this ministry. And it was in 2008 when the Ministry of Health actually refused to actually sign off the project with these premises. So due to that, we no longer have the opportunity for the users of the sports arena to receive consultations from medical specialists. And by this I mean that probably this issue should be addressed either centrally or regionally, so that each region at least would have the medical specialists who would support sports activities. Thank you. Do we have any further questions or comments? I represent the USHU Federation of Latvia. First of all, I would like to thank you all for your presentations, which was very interesting, just like something that you see on Discovery Channel. And I would like to ask Mr. Apinis, we know that after illness, school children are recommended to have 1 or 2 weeks off sports activities. Is it justified, or should we probably recommend quite the opposite, to actually engage in sports activities? Yes, this is quite a problem here in Latvia. We tried to change this situation, but it seems like 40% of children do not participate in sports activities at least 1 month a year due to different reasons. Of course, we have very many wonderful sports teachers, and of course they play a huge role, but also parents play an important role in actually encouraging, or the other way around, in discouraging children from sports activities. And thirdly, there is also a problem among medical personnel. And many opposed my conviction, and many medical specialists always prescribe a couple of weeks off sports activities after an illness. I would say if a child wants to engage in sports activities, then please choose a doctor who understands how it works. because unfortunately those who have experienced a lot of illness in the childhood in many cases become either nurses or doctors, and usually they are opposed, generally opposed to sports activities. So to a large extent it depends also on the doctor that you have for your child. And another aspect I should mention is the in-house nurses at schools. I don't know what are they actually doing. Probably they are there for emergencies, for first aid. And also they actually excuse school children from physical activities. Even in the simple case of menstruation for girls. So I am actively opposing these practices because all children need is to be active, and this is something that I'm trying to convince medical specialists. But unfortunately, I also meet with a lot of resistance against my point of view. But we continue to insist that more physical activities should be implemented or integrated in school programs. It seems like actually we are running out of time, so I will give floor to my colleague. Yes, let me just tell you about the Minister of Health, who is currently actually protecting this idea of introducing additional sports activities at schools. And he also talks about extracurricular sports activities based on the experience in other European countries. It seems like we have another question. Yes, I would like to ask Mrs. Nulle. It seems like there is a boom in attending gyms and weightlifting, which is becoming increasingly popular without any supervision from specialists or coaches. And actually they experience a lot of health problems due to that. Do you have anything to comment on this? Yes, thank you for your question. I think that I already mentioned in my presentation that you need some kind of mentor, advisor, because it is quite dangerous to do it on your own without appropriate qualification. Of course, in a way, each person should be responsible for what he or she does. But of course, we cannot keep someone from doing it on their own. I would say that each gym should have an in-house specialist who would be able to provide consultations to newcomers or those who make serious mistakes in using gym equipment. Thank you. I hope I answered your question. Yes, we have one final question, which we can't hear because the microphone is not being used.
Piemēram, ja es kā vecāks cilvēks gribu gatavoties pusmaratonam vai maratonam, tad es zinu, ka man jāaiziet pie ģimenes ārsta un jāsaka tā, man vajadzētu izdarīt to. Bet tu jau esi vesels. Nē, bet es gribu gatavoties, tāpēc man ir ieteikums Federācija padomjas mājaslapā, veikt kaut kādas analīzes, lai saprastu, es to drīkstu vai es to nedrīkstu. Tas būtu ļoti labi.
Anyway, we offer a variety of lectures to medical staff. We constantly improve the qualification of medical staff. We organize different kinds of training. Because, of course, there are various events that involve 24-hour runs, different extreme events where amateurs participate, and of course we have to take into account these trends whenever we deal with the medical side of these grassroots sports activities. And sometimes the classic office people spend the whole weekend running through forests. So thank you very much for participation. Thanks to everyone, and now it's time to distribute the certificates. Currently our hockey team is losing to Norway 1-3. And another thing, after you receive the certificate, you are welcome to join a guided tour across this building. So if you are interested, please use this opportunity. And on behalf of the Federation Council, please, I would like to thank you all for dedicating your time and for organizing this event. Thank you.